Hello everyone, I'm Dr. Ndlovu, currently based at Vivat Health Clinic. Today we're going to talk about your heart. As you all know, today is the World Heart Day, under the theme, we don't miss a heartbeat. So I want us to talk about what is the heart, and we're going to talk about the common conditions pertaining to heart diseases, and then most importantly we're going to delve more on risk factors and also how we can manage. It will also involve necessary dietary and lifestyle modifications that can help us prevent these preventable diseases. So what is the heart? The heart is a key component of the circulatory system, which helps to pump blood throughout the whole body. In so doing, it provides nutrients and oxygen to the rest of the body. It also gets its blood supply from the coronary arteries, which supply blood to the rest of the cardiac cells. So you will hear from the talk interchanging heart and cardiac. The most important function of the heart is to pump blood. So there are conditions where this can fail. So the easiest way that we can all understand is this: the heart can fail to pump in cases whereby it loses its blood supply, a condition that is known as coronary artery disease. It can also happen that it can also fail to pump blood to the rest of the body. This also is known as cardiac failure or heart failure. And sometimes it can also spontaneously stop pumping in a rhythmic way, which we call cardiac arrhythmia, or later on can also present as cardiac arrest. So these are the three common types of heart conditions, where there is poor perfusion of blood into the heart itself and it deteriorates and dies, or in situations where the heart fails to pump the blood to the rest of the body, and then the blood we call this heart failure, and then lastly a cardiac arrhythmia. So now, what are the risk factors to all these conditions that we have mentioned? So they are classified into two types. We have modified and non-modified risk factors. The modified risk factors are the most important because these are what we can do to prevent heart conditions. So as we all know, heart failure and all these other heart conditions, they are more prevalent in elderly people. So age is a key component. It's common amongst elderly, and it's also common amongst men, and also noted to be more common also in menopausal women, as also it has been thought estrogen and other female hormones are actually protective. But we want to dwell more on the modifiable risk factors. So modifiable risk factors, these include excessive alcohol intake. So also includes smoking. We actually recommend cessation of smoking. Also talk of sedentary lifestyle. You need to have an active lifestyle, exercising, recommending aerobic type of exercises, and also dietary intake also needs to be modified. That is, have food less in salt, food less in saturated fats. So saturated fats includes food that is coming from animal fat. All those animal fats, those are not good for your heart. So all this is based on what we have spoken about atherosclerosis and coronary heart disease. So also other things, we need to monitor our heart hypertension and diabetes. All these contribute into preventing heart failure in the long run.